there's important things to learn that medicine still doesn't recognize, that they can be doing things wrong and things that in the longer run can hurt people. So it's a really good time to come back around and flesh out what you need to know about vitamin D in the times of COVID. We're constantly watching what the body says to us. How am I doing right now? Do I need these crutches anymore? Same thing for the vitamins. We watch and see how long they need it. We always imbue the vitamins with the power to take away the sleep as well as to give the sleep. Much of what we're treating with, oh, you'll just have to have a joint replacement, you'll just have to have a heart replacement, you'll just have to have a liver replacement, is because we haven't gotten our hands around this potential to heal.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 259. My name is Andrew.
And this is Michelle, drinking coffee and not wine.
It's early in the day and it's freezing out there. Well, it's not. Okay.
It's not freezing.
It's not freezing. I should not be so.
Even for me, that is dramatic about the cold, it is not freezing.
As they get like 44 inches of snow in upstate New York this week. It's like, oh, whoops.
Yeah. All of my friends I got the rain. And being in South Carolina and everybody got the snow, and I was like so jealous of everybody's like snow pics. And then everybody was like, oh, I have to go shovel. And I was like, oh, never mind. I'm not jealous.
And then you're laughing at them. You're like, oh, man.
I'm like, oh, I don't even know what that life is like. I've literally never shoveled snow, had to shovel snow. But that one time it snowed in South Carolina, I said literally like 47 times already, but I almost died on my porch because like nobody had any like snow tools. So everything just iced over and we were like trapped in our house.
So in one of our first houses that like, okay, so when you're an adult, like sometimes there are things that you just don't learn as a child, like the importance of shoveling, the sidewalk and things like that. And so in our first home, in a place where it stayed cold for, weeks on end sometimes, and it would get to like 0 degrees. So it snowed. I took most of the snow layer off as I was shoveling it, but I didn't like always get like all of it down. And we had like a gravel gravel driveway. And then the sun came out, it melted a little bit and then refroze, and it was a sheet of ice.
Yeah.
And so I didn't realize the importance of making sure that you do a good job of shoveling all the snow. And then it was there for weeks after that. You try and use like ice melt, none of that would work. You try and use sand, none of that would work because we were also on like a hill. So it was terrible. Just the worst.
I hope you were grounded.
Yeah, I mean, oh man.
Well, this is a dental podcast. If you are new and coming to listen to a great interview that we have today, we are two dental hygienists, and thanks for hanging out with us for a little bit. But we do this month has been fantastic. We're not like speaking specifically to dental hygienists or dentists, but we have people that could gain some value from all of our interviews this month. I love it.
For sure. Oh, and by the way, Merry Christmas.
Oh, Merry Christmas.
Sorry, we should have led with that, by the way. Not to detract from our...
Because I'm okay with saying happy holidays.
I'm okay with saying whatever. Merry Christmas to the people that are Merry Christmasing and all the other ones.
And the ones that aren't, and the ones that are celebrating Hanukkah and any other.
Kwanzaa and
holiday.
All of the holidays of this time.
We like to be inclusive
Super
here
inclusive.
On this podcast.
So... interesting enough, this will be like the first, I think, weekend that I have a lot of like free time for the holidays, and I have 0 things planned, and I don't know what to do with myself.
Do you remember though, like, it was because I guess the next 2 weeks or last 2 weeks of December, it's like 3-day work weeks essentially for a lot of people, right?
Right.
Do you remember at the very beginning of 2020, there was like this meme that came out that was like 2020 is going to be the best year for all holidays. Like Cinco de Mayo is on Taco Tuesday. 4th of July is on Saturday. New Year's and Christmas are on, Friday.
Oh my gosh.
What a joke.
What a joke.
2020.
Oh man.
Celebrated Taco Tuesday, Cinco de Mayo at home. Boo.
I like how we started off this episode not dental, and then you tried to bring me back in, and then I just derailed us again.
And then now we're talking about tacos.
I'm so sorry.
Well, that's okay, because I am going to bring it back, because I wanted to tell everybody. So this interview that we're having today is with Dr. Stasha Gominak. This is the third time that she's been on the podcast. Once was a Facebook Live that's on our YouTube channel that gets tons of comments and traction. Mm-hmm. But after this interview that I did, it's been a few weeks. And if you've been listening for any time at all, you've heard me. I'm like dabbling in the vitamin D. I've been messing around, right? Yeah, I haven't been doing it exactly as Dr. Gominak has suggested, but my sleep is garbage. But I would never have guessed, right? So after the interview with Dr. Gominak, got it together. I went and got my D tested again. I printed out her workbook. I have this huge chart in my room where I'm writing down everything. So I'm really on top of it. And I will say this workbook is really fantastic because my history, and maybe other people fall on this too, I have never thought that I had bad sleep. And I do hear this actually pretty frequently. Once I lay my head to the pillow, I am out. I've always felt like I'm a good sleeper, and I wouldn't get up. I don't wake up in the middle of the night and can't go back to sleep. I've never been like that person. I'm out, head to pillow, done until the next day. However, I could not wake up very well. I'd still wake up feeling groggy. Mm-hmm. I mean, I could sleep a solid 10 hours and be okay. Which is not normal. That's not
for a healthy adult, probably not the most,
not normal. But definitely one of those snoozers, hits the snooze 47 times and gets angry at myself because now I'm going to be late, and time is my sign of respect for people. I don't like to be late for things. And so I've always had this it's been very cyclical, exhausted, fall asleep, sleep all night, can't wake up. But I also have a ton of parasomnia. So I've always known that I am a sleep talker. I grind and clench like crazy. I was a sleepwalker as a child. So I've had all these parasomnia. So obviously I'm not getting good sleep. Well, the last 2 weeks, I have increased my vitamin D because I'm still super low. I've taken all the things that she said. I've done the B50, and the workbook goes through all of this stuff. I found exactly the vitamins that she was talking about. I'd say it took me about, and my manifestation of low B vitamins is a burning tongue, which is hilarious because I've had burning tongue for years. And if a patient had come up to me and was like, my tongue's burning, I'm like, let's talk about some B vitamins. What do? Oh, this is so weird. I wonder why I have that.
Typical.
So anytime my B vitamins, it's within, if I can get on my Bs, within 2 days, my burning tongue is gone. So that's my trigger of something's not right. My tongue is burning again. So then I go get tested or whatever. Well, my burning tongue is gone. Thank God. It only took 3 days because that's so annoying. And I have had garbage sleep. And I don't want to so I want to tell everybody, I started this workbook. And I would say garbage sleep because I'm having a hard time falling asleep. I mean, it'll be 11 o'clock and I'm still feeling like I'm wide awake. I have been waking up at 3, 4. I'm having insane dreams. But I'll wake up at and let's say I wake up at 4 o'clock. I'll wake back up or go back to sleep and wake up at 6 without an alarm. Pop right up out of bed. I am not tired. I am not exhausted. I'm going all day. I mean, it is bizarre. So just know that there's if you're going to take this and do this workbook, if you're going through any of these things, just try get your vitamin D tested, test your Bs, see, and it's going to be a journey and in 2 weeks, right after Christmas, I have to get my vitamin D tested again because you get it done every month for about 3 months, keeping a journal. But man, I'm so glad I'm getting it together this time because now I can actually be okay, this is how I felt at 10,000 IUs of D3. This is when my burning tongue stopped. And when I have this many B vitamins or I'm deficient by this much. It has been quite the journey. I don't love this whole vivid dream wake up at 3:00 with the most, and then just like can't go back to sleep. But I have not been able to wake up without an alarm and like not be tired and exhausted all day.
Gosh, that's got to feel good.
It feels so good because obviously I've been working with Michelle Galloway also with my whole life coaching and getting my mind right. But my self-talk is horrible. Like I am not kind to myself at all. I know everybody's going to be like, oh, but you're constantly going. If I don't get like one thing done in my list of being productive, I am so mad at myself. And the self-talk is horrible. But before I was like so tired, I was so exhausted. I wasn't doing things. And and I say before, like 38 years of my life, like and so I feel like, oh my gosh, like I'm cleaning up the self-talk. I don't feel so exhausted. Just know that there's hope out there. Like if I can get through this, and I was that person that going into this, that I sleep. And there's no question. I sleep. I go to bed 9:00. This was the other thing. 7 p.m. I could have gone to bed at 7 p.m. without question. I mean, how many times I'm like, do we really need to stay up? No, I'm real okay with 7 p.m. and then sleep all dang night. I don't feel like that anymore. And like, that's not how you should feel. And now that I'm experiencing it, I'm like, oh, wow, this is nice. But I'm going to get to a point where I can sleep restful, like not wake up at 3:00. Like I just got to find my course with the vitamins. But I just wanted to tell everybody the story because it's been fascinating to go through it and experience it firsthand. And I'm just, I like that I'm not tired.
You know, when someone gives you like a little clue into their life, then all of a sudden you're like, oh, now I think I see something. You spoke probably at least 5 minutes straight there. I don't know if you took a breath that whole time. You have this energy about you right now. I'm like, dang, okay, you are in this.
Well, I mean, of course, I'm anything that I experience firsthand, I become like evangelical about it. Like I spread it like crazy because I'm sure there's some people out there that have gone through the same things as I have. You know, sure. I would say I have historically had a lot of energy and I pile a lot of things onto my day, but to be going through that feeling like I was for the last 30 years of my life and now feel the lack of exhaustion and just like, why do I eat food and immediately feel like my body is like, yeah, you're done for the day. Like that kind of stuff doesn't make sense. Like, yes, there's rest and digest, but to not feel like you can go on with the rest of the day just because you had lunch is crazy.
Yeah.
So I don't mean to like ramble for 5 minutes. However, this is a very interesting experience that I'm sure will help somebody else.
Oh, I'm absolutely sure it will. And I think it's nice to know that it's not all like butterflies and rainbows. This is,
It's not, but I also don't want to like scare anybody and be like, oh, I don't want to wake up. I'm waking up and like getting less sleep by clock standards, like hours, but I feel so much better. I'm also using that Brux relief that is monitoring how many parafunctional habits like clenching and grinding. This is a new thing that I just started trying out. Brux relief. It's BRUX relief. It's like a little it's not biofeedback because the FDA would lose their mind, but it sits on your temporalis at night and it will clock how many times you clench or grind your teeth. And the other night when I did have horrible, horrible sleep, I had 600 events.
Whoa.
600 clenching and grinding events. Like it ended up being like an hour worth of my night was spent clenching and grinding my teeth. So
holy crap.
It's interesting if that's your parasomnia, and to like digress again, I can continue to speak and make this the longest like intro ever, but we have normalized night guards and clenching and grinding. Have we not?
We have.
Our industry, right?
Oh, yeah.
Yes. And I have definitely been on that boat. It was like this is a cult, sign up. Like everybody needs a guard. Everybody needs to be protecting their teeth at night. Like this is what we do. It's stress. It's poor occlusion. There were so many things that we've said over the years to our patients, right? But when you listen to Dr. Gominak, and if you go back to her original one, if you listen to her Facebook Live that we did that's on YouTube and listen to this one, that is not a normal thing. You should be asleep. You should be paralyzed. You should not be getting up, getting water, going to the bathroom, clenching and grinding, sleep talking, restless legs. These are not normal behaviors if you're getting the proper amount of sleep and proper sleep. So this is my call to action, is like, let's stop normalizing night guards and clenching and grinding, and like, let's get to the root cause and let's truly help some people, because I've had a guard since I was 16 years old and nobody has gotten to the root of my issues. And look how much I've suffered just from like a sleep standpoint. So that's my call to action, and welcome back to the dental side of it.
Let's just go ahead and throw the interview then, and then we'll make the outro very, very short. Very,
very short. Well, enjoy this episode with Dr. Stasha Gominak.
Hey, Michelle.
Yeah?
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine. Okay, listeners, I'm really excited for another fantastic returning guest. I love December because we get to recap everything, and some of your favorite episodes, I think they've been more on that higher level of patient care. And I'm so stoked about that. And I want to welcome back someone who I have heard multiple times and still take some serious pearls of wisdom from each time I hear her. But welcome back to the podcast, Dr. Stasha Gominak. How are you?
Good. Hi, Michelle. Thanks for inviting me. I'm thrilled to be here.
Oh, well, your episode was super popular, and I still send people to listen to it. And I have heard you in person. I did the podcast with you. I've listened to it multiple times. And every single time I listen to it, I'm always taking something back for my own personal health, but then also the discussion that I have with my patients. And what I'm really excited about is that I'm hearing and reading more about vitamin D3 specifically in my dental journals. So are you seeing that too? And how happy does that make you?
It's a mixed bag. And I'm really glad we're coming back and revisiting this, because vitamin D is hitting the front pages of the newspapers now. That is fortunate because it brings up these requests for podcasts and webinars, but there's important things to learn that medicine still doesn't recognize, that they can be doing things wrong and things that in the longer run can hurt people. So it's a really good time to come back around and flesh out what you need to know about vitamin D in the times of COVID.
Love it. So let's get into it. Where should we start?
Here's where I'm going to start. First, if you haven't watched any of the other videos, there is some very basic ideas that are different than anyone else is talking about. That's why I have a website. I'm going to trace out those 2 or 3 ideas, and keep in mind that if you haven't heard the other lectures, you're going to need to go back and learn that.
And we will link that in our show notes, everyone.
So by a series of weird accidents and clinical observations, I actually realized that there were articles that show that vitamin D is heavily involved in how we sleep. And that's linked to how animals hibernate. And the reason why we're linked to D is because we have to sleep different amounts in the winter than in the summer. The second really important observation was that getting the vitamin D back into the right range did make our sleep better for a while, but at about 1.5 years to 2 years, the sleep started to fail again. And our pain got really bad, and we still had good D levels, but we weren't feeling very well. And that is very important. I'm going to tell you about what happened later, and then we're going to circle back around and say, how do we avoid this happening to us? So first, I thought D was going to be the whole answer, and it wasn't. And here's why. When the D makes the sleep better, the sleep is using the building blocks of repair, namely all the other little things that are called B vitamins and other vitamins. So when we want to sleep better, we don't want to just be unconscious. We want to actually repair our body. And that takes the building blocks of biological repair. And it turns out that all of us who have low Ds also have lost our microbiome. So the thing that makes it easy for me is there's lots and lots of literature that's recognizing that we have the wrong bugs in our belly. And getting them back is really not about probiotics, because the probiotics don't work. So what does work is recognizing that there are 4 different bug types called phyla. Those are big families, 4 families of bugs. And those 4 families hang out together in our bellies because they feed each other growth factors. Those growth factors are called B vitamins. So there are 8 B vitamins, and there are 4 families that are making and feeding each other those B vitamins. Those B vitamins are pivotal for normal sleep. So my patients who were doing D were doing D and getting better, but their bugs were bad. And when we used up all of our B stores, so that's a second concept, we actually have stores of B vitamins. When we run out of them because we're trying to sleep better and do more repairs, if we don't have the primary source, which turns out to be the bugs in the belly, then we get new symptoms of B vitamin deficiency, like problems with our sleep. And it looks the same as when we first joined up. So vitamin D deficiency really never hurts anybody by itself. But almost everyone who's D deficient is walking around the world looking perfectly like a normal human, but they're not. They do not have a normal microbiome. They're missing a very important organ in the body. So to get them back to being a normal human, you have to not only get the D back into a 60 to 80 range, which is perfect for sleep, but you have to bring their microbiome back. And the way you do that is to feed the bugs D and recreate their B vitamin soup that these 4 families used to make. So there are still some of the primary good guys down in your belly, but they are not the prominent, supportive, make you a healthy human. They aren't at the right number. So what you do is take D and B50, which is 50 milligrams of each one of the different Bs. There are 8 Bs. This is well described on my website, and there's a workbook that will walk you through it. But in summary, you do a combination of these growth factors and the bugs just grow back. And it's not that complicated. It's pretty simple. You do it for 3 months, and then you stop the big dose Bs, because it turns out our body was really made around the amount of Bs that these bugs make. So you have to picture it more of in an evolutionary way, where the bugs were here for billions of years before multi-celled organisms came, and they were happily finding their buddies, hanging out as a foursome, and they're called a symbiotic foursome because they each supply at least 1 B vitamin, that's a growth factor, to their buddies that live nearby, and they themselves need a couple of growth factors. So it's a foursome that creates this environment that has all these 8 growth factors floating in it. That actually is something that I believe humans knew back in the 20s and 30s when they were clarifying bacterial growth factors, but it for some reason has been lost to our knowledge. So it's really important that you should recognize that it's the bugs that make the B vitamins. They do not come from the food. There are still some Bs in the food. In fact, they're probably from the dirt that has the bacteria in it on the food. So as we compulsively wash our vegetables, we have actually lost some of the source of the vitamins. So the major source of the B vitamins are the bugs. Now, why is that important to me? Because the microbiome is an integral part of the immune system. So every single human that's walking around looking like they're normal, but has an autoimmune disease or a altered immune system, like every child that has allergy or asthma, every one of us who has a peanut allergy, all the kids that have reacted in a very odd and dangerous way after being COVID exposed, where they get an autoimmune disease, those are all people who are walking around looking normal, but they do not have the belly bacteria. That is a very important organ in the body. Now, the next piece to know is once you get that microbiome back, it then has to integrate into the multiple other parts of our immune system. So getting the organ back is just day one. Then we have to learn a little bit about, what are the symptoms that I'll get when I'm doing better? So we're going to integrate that information. What we're going to do in the second lecture is say, okay, let's say we know about D and the microbiome. Let's delve a little deeper into how do those vitamins actually manifest in my body? What are the symptoms that I'll feel? What are the diseases that I'll get when they're not right? So most of this is based in my observations of my patients. So what happened to me was I did D, we got better, and then all of us started to have pain, and I didn't know what the hell was going on or why we'd have pain. And then somebody brought me a book about a chemical called pantothenic acid. So the rest of the lecture is going to be about what we actually know about pantothenic acid, and then another chemical called acetylcholine, and why it's important to you to know what acetylcholine is, why acetylcholine is going to be the most important chemical for the next 10 years, and also why it is that none of the other sleep experts are talking about it. Okay, so I fell into this literature pretty much by accident. So I'm going to tell you the story of pantothenic acid and then why it's important to you. It turns out there's a chemical that B5 is used to make that's called acetylcholine. Acetylcholine is the chemical that's responsible for our ability to concentrate, stay on task, and not be anxious. When it's too low, we can have anxiety. When it's too low, we can't concentrate. When it's just right, we're operating at our peak. We can be distracted, come right back, and be very focused. Acetylcholine is also used to allow us to fall asleep, stay asleep, and get paralyzed normally in sleep, which means it's linked to grinding, it's linked to sleep apnea, it's linked to leg kicking, it's linked to waking up with pain in your joints that are moving inappropriately when they're supposed to be paralyzed. So it has this one chemical, oddly enough, stays at the same level in a normal human who is receiving this pantothenic acid stuff that's being secreted by its bugs. So a normal human has a specific amount of B5 every minute of every day. During the day, we're using it to be awake. When we flip a switch and we're asleep, we're using it to stay asleep. That's a very different concept. We don't think of it that way because humans have come up with sleeping medicines and alerting medicine. So I give you modafinil, or I give you methamphetamine to your kids with ADD. We have thought about it as one chemical promotes sleep and another chemical promotes being awake, but it's really not like that. There's one chemical that actually is integrally involved in both states. That is very well documented in the animal literature. The weird thing is that we as clinicians for sleep have not picked up that literature and done anything with it. So I'm going to step back for a moment and say, many of the things I got interested in were based in kind of accidental observations of my patients. And I want you to hear about that because it's not like I just go to the literature and make this stuff up. Okay, so I'm going to give you the brief recap of one of the most important things that happened to me. So I've got 1,000 patients. They're young, healthy females with headache, or teenagers or kids with headache. I've done sleep studies on all of them. They have very characteristic sleep studies that show they don't have enough rapid eye movement sleep. And it's not that their airway is difficult. They don't have apnea. They just can't get into this particular phase of sleep. And I'm wondering about that. And then I stumbled in this literature that shows that vitamin D receptors all over the switches in our brain that allow us to fall into and stay in REM sleep. So now I have this great information. We give a bunch of vitamin D to these people that have their sleep studies. They all get better, and then they get worse again. And their sleep goes back to being terrible. They start to have pain again. And I really don't have a good answer for it. And then, as I said, this patient comes in and gives me this book about B5. Okay, so pantothenic acid is an overlooked vitamin. It's a vitamin that was studied in the 40s, 50s, and 60s, and 70s. And then somebody made this incorrect comment, which was, there is no such thing as pantothenic acid deficiency because it's in every food. Well, it turns out it's not in any food. It's only being made by the bacteria. Now, here's what happens. I don't know that yet. All I know is this patient brings in a book. I've got these patients who are floundering in sleep again. My vitamin D level is fine, but I'm not sleeping. I have this peculiar butt pain. My patients are all complaining of pain. So I'm pretty desperate. And a patient brings in a book about pantothenic acid. So I go and I get this 400 milligram pantothenic acid pill because that's what it says in the book. It's sitting on the shelf, innocently sitting there in the drugstore. And I take 400 milligrams of pantothenic acid and 100 B100 with it. Okay, so B100 is all 8 Bs and 100 milligrams of each. So I'm trying to cover all my bases because what we have all been taught is you can never hurt anyone with B vitamins. That's an important lie. You can really hurt people with B vitamins. Number two, we don't have any stores. We just pee out the extra, and that's why you can't hurt anybody. All right. So that's what I taught. So I go and I take a total of 600 milligrams of pantothenic acid, 400 in a pill, 500 milligrams. 400 in a pill, and then a B100. And I give that recommendation out to about 40 people over a week. And it's all the people that I have a sleep study. I know what their D levels are. Their D is fine now, but they're all floundering. And at the end of the week, I notice that I have terrible restless legs. I have restless legs morning, noon, and night. That is my sleep disorder. And I realized that probably this 400 milligrams of pantothenic acid is too high a dose, that it's the wrong dose, even though that's what it says all over the internet in the drugstore. Now, my patients start to trickle back. So what I did in response to that was to stop the 400 milligram tablet and just stayed on B100. And like magic, my sleep got immediately better and my pain went away. That was particularly peculiar because these B vitamins are supposed to be completely innocent. Like you cannot hurt anybody. Nobody tells you to pay attention to B5 and whether or not your sleep is any better. So I noticed it was like a day-night, totally different experience to be on 500 milligrams of this pantothenic acid versus 100. Then I have to sit for the next 6 months and wait for my patients to come back and say, hey, were you trying to kill me? So they did 400 milligrams. And then they came back and said, this stuff immediately made me so agitated, I couldn't sleep at all. And I only took it for 2 days. Some of them were very angry with me, which I completely understand, but wasn't written. The truth was not written in the literature. Some of them stopped the 400 milligrams and did what I did, which was to stay on the B100 and said, this is so weird. I stopped that 400 milligram tablet and now I'm taking this B100 and my pain went away in a day. It's like a miracle. I was miserable and now it's gone, or it's definitely 50% better and it's getting better. My sleep is so much better. Now, the peculiar part about this is if pantothenic acid is in every food, that should mean that every time we take 3 avocados and 2 heads of cabbage, we've changed the dose of pantothenic acid and it should have affected my sleep, which we know that doesn't happen. So the first assumption is, one, they're absolutely wrong about saying that pantothenic acid is in every food. It's not in any food, okay? That's number one. The second one is to say there is no such thing as pantothenic acid deficiency because the other 2 patients who I had at that time had terrible burning in their hands and feet, and they were young, healthy females with daily headache. They had nothing else wrong with them, and it was particularly peculiar because those 2 women who had nothing in common except they were just seeing me and they were doing vitamin D for 2 years walked in the door within a month of each other with the same complaint. I'm a neurologist. Neuropathy is my subspecialty. I've been practicing neurology for 30 years. Burning in the hands and feet is extremely unusual, and it's almost always B12 deficiency. But they were already on B12. Their B12 levels were fine. So this suggests that they have some other B kind of thing, maybe. Maybe I've induced a B vitamin state in these women by giving them vitamin D, encouraging their body to heal, and they've actually run out of their stores, okay? So that's what we're talking about, the microbiome. Now, that implies that this B5 that I took as a pill goes right into my belly, gets absorbed in the blood, goes right up into the head, and the dose that I take produces this acetylcholine stuff that makes me all buzzed up. That's weird. Like these neurotransmitters, like somebody's supposed to be running the show. Somehow I'm just running my attention and my sleep from the bugs. I mean, that implies that the amount that the bugs make are my only source and they're running my whole life. Now, at the time, that seemed extremely peculiar to me, okay? That just doesn't make any sense. Now, in the meantime, between about 2013 and now, there's all this literature that shows that the brain is directly linked by the vagus nerve right to the bugs, that the vagus nerve talks to the bugs and the bugs talk to the brain. So there's all this other literature that's suggesting these ideas that at the time were completely crazy. Like, okay, I like having a normal microbiome so that my belly will feel all right. But the idea that the bugs talk to my brain and my brain talks to the bugs, that's just crazy. So I saw several things happen that made me suspect that if this is true, that means the only source of this B5 is the amount that my bugs are making minute to minute or any supplement that I add. So one, I got to see what it looked like to have way too much pantothenic acid. Agitation and sleeplessness were the 2 things that all these different people said. They used the same phrasing, which was really peculiar. Now, at the time, I didn't know about acetylcholine. But I'm going to put that in a context for you and then fill in the science that explains what happened to them, okay? So as I'm about to give a lecture about this observation, I think, I better go back and really find out what this B5 is making and why it's produced this experience. So at the time, when the book was brought to me, all we had in there was B5 becomes coenzyme A. Coenzyme A is pivotal for making cortisol. And that part was well known, and it was published in the 50s, 60s, 70s, such that there were actually studies done 60s, 70s, and 80s trying to use pantothenic acid to treat autoimmune disease. But they were never really successful, so it didn't actually pass into our literature. Now. It was studied, didn't have good success, and now we moved into, there is no such thing as pantothenic acid deficiency. So I know about cortisol, but to me, that was not enough to explain why they got agitated and couldn't sleep. Then I stumble into, if I put into the search engine coenzyme A and the brain, what I get is acetylcholine. Coenzyme A is necessary to make acetylcholine. And then we get to the next little line, which is acetylcholine determines our level of alertness during the day and our ability to focus and sleep at night. So now I trace through all the actual mechanisms. So now we have neuroanatomic studies that show here's acetylcholine in these various wiring diagrams that allow us to get paralyzed. It also is one of the neurotransmitters that allows us to fall asleep, stay asleep, transition between these stages of sleep. All right, now, the next weird thing is when my patients are taking B50 and bring their bugs back, if they stay on it a little too long, what I got nervous about was, I'm really excited about the potential of making your belly environment favor these 4 families. What we've done with that is we've given all the growth factors they need to be happy. They're going to grow back. But here's the problem. You don't know they grow back. You're taking it for 3 or 4 months. The bugs are back. Now they're making the normal amount that your body's biology was actually made to accept and use. And you're still taking B100 or B50. So you're doubling the dose of what your brain is experiencing, what your body is experiencing, but you don't know it. So actually, I went through a lot of stumbling with my patients. I said, look, if I'm right in thinking that these bees are going to bring back your microbiome, what I'm worried about is sometime in the future, you're going to start to have sleep disruption and pain again because you're going to have a double dose, just like those people that yelled at me, okay? My patients were smart enough to notice that happened exactly at 3 months. So they stopped it because I warned them, hey, these symptoms come back, you stop that B50. But I was too stupid to do that. So I went into the 4th month and then in 4.5 months, still taking B50 and my bugs were back. And I started to ache all over and my sleep went to hell. So I physically experienced this thing that was my theory. My bugs are back, but I'm still taking 100 milligrams of this stuff. So one of my patients said, hey, you gave me B100. It made me ache all over like I was 90 years old. And I thought, that's what I feel like. And she said, I broke it in half and now I'm on B50 and I feel fine. And I thought, I've been warning all my patients that they should stop this stuff so I stop it and all the pain goes away and my sleep immediately goes back to normal, which is extremely peculiar. Now, what that means is too little B5 causes the same problems as too much B5. That makes it really confusing. All right. So we're going to get into that a little bit more in detail because unfortunately, everything I'm telling you is in the field of medicine, but your doctors are not going to know about it. That means I'm leaving you out there on your own. I'm introducing these ideas about how to make your kids and yourself have a normal immune system, but I'm actually introducing you to chemicals that are kind of dangerous. You have to learn how to use them. And the most important thing to recognize is B vitamins are not innocent bystanders. They are aggressively part of your nervous system. Too much and too little both cause the same problems. Some people get burning. Some people get physical pain that's like arthritis. Some get pain in their legs or other parts of the body because they're not getting paralyzed correctly in sleep. They're actually activating or contracting their muscles. So when they wake up, they feel like they've been beat up. So this acetylcholine produces really, really uncomfortable things, both when it's too low and when it's too high. Okay, now we're going to delve into the details of that. So I want to introduce the idea that I lived through these experiences, and I have many other clients that have lived through them. So I then go looking for the literature that supports that. Okay. Now, at the time that my patients were trying to use B5 and B50, and I was using B50, there were these other weird things that happened. Like somebody stays on their B50 2 months too long, and now they have these weird rashes. They've got funny itchy rash. They got hives. They got all sorts of things that I don't really have any explanation for. They show up with things like COVID toe, the same picture of that purple toe that you might have seen in the paper. Some of them walked in the door with that. Some of them got terrible burning when they stayed on it too long. So I'm still learning this concept that too little B5 and too much B5 both walks in the door looking the same. All right, so that's one general concept. One, B5 only comes from the poop bacteria. They are a very important part of our body, and therefore you really want to get those guys back because they supply some chemicals that run your immune system and your ability to think. The second concept is once you get them back, if you keep taking B5, you are not going to be a happy camper. You're going to feel awful in various ways, and it's going to be just like the symptoms you had only 6 months ago. Now we're going to move into what the science is in the background. So now that I know acetylcholine is playing a role, I'm pulling these articles about, first, what about acetylcholine and ADHD? Because from a clinician standpoint, there were several things that I did not learn about in medical school because I was in medical school late 70s, early 80s before this epidemic occurred. So the things that weren't part of our curriculum were sleep apnea, fibromyalgia, chronic fatigue, irritable bowel, ADD, autism. ADD and autism were extremely rare in the 60s, 70s, started to increase exponentially since the 80s, and have just continued to increase. The incidence of autism is going up and up and up every decade. Now, does that suggest that somehow they're linked to vitamin D? Yeah, it does. But it turns out the more important chemical is really the acetylcholine. So now that I know about that, I start pulling articles, and it shows that the study of the frontal lobes by the neuroscientists who are learning about how to study ADD are publishing articles that are showing, oh, in kids with ADD, we can do imaging studies that show that their acetylcholine levels in the frontal lobes are too low. Now, the weird part about that is I'm a neurologist. Acetylcholine is a familiar word, but when I pull it up, what I was, in the very beginning of this, I was thinking, acetylcholine, what does it do in the brain? And the weird thing is, not only will it be a new word to you, but as a neurologist, I don't have a whole bunch of things that pop up. And as I'm thinking about that, I think, well, neuromuscular junction, it's in the autonomic nervous system. But I begin to think about the fact that, well, why don't I know what this does? I know what serotonin does. I know what dopamine does. I know GABA. I know all these other neurotransmitters. I know them by the drugs that we have. So I learn about dopamine by giving dopamine to Parkinson's patients. I learn about serotonin reuptake inhibitors, making us happier. There's not a single drug for acetylcholine, except one, nicotine. It turns out nicotine is one of the things that we hear when we're learning our primary physiology and pharmacology in medical school or dental school, because the actual function of the nerves that are run by acetylcholine, the very, very beginning study of this in 1930s and 40s, we describe here's a big nerve cell, it has a long process, it has these little packets of neurotransmitters, in this case acetylcholine, and then it releases them and it hits nicotinic acetylcholine receptors or muscarinic acetylcholine receptors. That means the primary drug that we have that mimics the effects of acetylcholine is nicotine. And the scientists that are reporting ADD are saying, the kids who have trouble focusing have lower acetylcholine nicotinic receptor activity. Therefore, when they get to the conclusion, they say, we should really be giving these kids nicotine because methamphetamine is not what they're lacking. They are not lacking adrenaline. So adrenaline is the norepinephrine and epinephrine. So those sides are chemicals that are part of the fight-flight system. We are giving those kids those stimulants, but they're not really what they're deficient in. They're really deficient in acetylcholine.
I'm just I'm still trying to process that the study said to possibly give kids nicotine?
I'm coming to that.
Okay.
Yeah, I'm coming to that
And I
because
was like,
I'm reading those
my little
articles.
brain is just going, God, let there be more to this.
Yeah, I'm reading those articles going, yeah, right. Like, I'm really going to convince those 35-year-old moms who this is the most precious being they've ever had in their family. And what are they going to do? Have them go smoke at recess? They're not going to do it. That's crazy. Okay. So the fact is,
Bring back the smoking in the station wagon situation.
yeah. Okay. So we're going to go into that a little bit more.
Okay.
Because the reason why people get addicted to nicotine is because they're acetylcholine deficient. And if you'll think back, if you've ever been a smoker, if you know someone who's a smoker, someone who gets addicted to cigarettes feels calmer when they inhale. I personally inhale, I throw up and feel agitated. That means that you've just given this drug to someone whose normal level is already there. They have a totally different response than the person who's deficient. So the people who smoke tell you that they calm down by smoking that cigarette, which has never made any sense to me, okay? They will also tell you that they get up and smoke a cigarette and go back to bed because that same acetylcholine. So that explains all sorts of weird things. Like one of my daughters smokes and she can't sleep without smoking. So that means that we are all somewhere on this line of perfect acetylcholine or too low. And the actual cigarettes are around because so many of us have become progressively more and more acetylcholine deficient. Now, it turns out that they're actually doing studies in kids using nicotine patches so they don't have to smoke. And autistic kids also have neuroimaging studies that show that their acetylcholine levels are really low. And they've shown that nicotinic stimulation using nicotine patches helps them calm down, have less behavioral problems. And as we get into this a little further, I'm going to link the microbiome to the endocannabinoids. The autistic kids also have a very screwed up sensory system where they sense things physically touching them as uncomfortable, and they can't think, they can't quiet, they can't stop doing repetitive behaviors. So they have not only an acetylcholine deficiency, but their endocannabinoid system is all screwed up as well. So they have multi-layered issues in their neurochemistry. But the fascinating part is there are now these articles that are popping up going, I can't believe it. They did nicotine patches for these kids for the ADD, and they show that they do better. Okay. Now, what does that imply? Does that imply I want all of you guys listening to this to give your kids nicotine patches? No, that's not what it means. What it means is if your kid's microbiome is normal, you won't need all those drugs. Okay. There is a simple way to reconstitute your kid to be a normal human. Now, is that important for ADD? Sure, but it's most important right now because that same microbiome that you've put back together to help your kid concentrate is also going to be the cornerstone of a normal immune system. It's not the ADD that's going to kill your kid. It's going to be not having a normal immune system because they can't fight infection, they have chronic infections, and the incidence of autoimmune disease in children just goes up and up and up. So what we're seeing in this COVID exposure is not only about this virus, it's about the state of immunity of the globe. So ironically, there are populations like in India. So I'm watching this unfold, having my own ideas about it, but not only is it that the front page is saying vitamin D, low vitamin D means worse outcome. Then it says darker skin, worse outcome. Obesity, worse outcome. Underlying chronic illness, worse outcome. All of those are linked to D. If you have darker skin, you block the formation of vitamin D. It really means that your body was made to be at the equator, and you really do, if you move up off the equator, you need more exposure to the sun than someone who has very little melanin in the skin. Now, the other thing about that in the background is that would kind of imply that if we go to India and we say, what's the outcome in the wealthy, usually working in an office? So when you move up the socioeconomic ladder, you're not picking garbage out of the garbage dump. You're not digging in the dirt. You're not at the lower end. And also, people who are at the lower end of the socioeconomic status usually are farming or outside because they don't even have a house. So the interesting thing in India has been that in the more rural populations, they have had COVID, but their outcomes are slightly better. So that means there are several observations that are all linked together and all come back to this core idea that when your D is low, your microbiome has gone bad, and now your immune system is bad. What that does is it gives us a path to follow to reconstitute the D, get the D up to where it should be, and bring back the microbiome, and then have both of those pieces be healthy. Then day one after we have our microbiome back, we're sleeping better. That sleeping better is the most important part. None of this happens without better sleep. Using the vitamins should always be paying attention to how the sleep is. Because remember, I only found out that the vitamins should need to be taken away when the sleep fell apart again. So the thing that made this work for me was I was stepping into the vitamin world, not because I was interested in vitamins, but because I was interested in sleep. That means I'm always about what is making the sleep better. If the vitamin is hurting the sleep, then you take it away. That means I observed things that were linked in time over these changes that happen biologically in my patients. So the bottom core idea is children do better when they sleep better. Doesn't matter what's wrong with them. Their autism gets better, their behavior gets better, their mood gets better, their immune system gets better when they're sleeping better. So that any intervention that we do along the way, no matter what it is, better be producing better sleep. That's the way we judge if we're moving in the right direction. So we're going to go back a minute and now say, remember how I said, gee, this is about level of attention, distractibility, anxiety with the effects of acetylcholine in the brain. But there's now a second piece that I noticed when they stayed on B50 too long and ended up on too high a dose of B5, that they started to have hives and weird rashes. And that just left me totally confused. Okay, now, it turns out in the last 10 years, there's this other system that uses acetylcholine that has now been fleshed out. And actually, one of my clients turned me onto the literature that opened up this door for me just this year. About 10 years ago, they started to do vagal nerve stimulation. They've been doing it for longer than that, but about 10 years ago, vagal nerve stimulation was shown to have not only what we were looking for, which was when we stimulate the vagus, we actually have this release of acetylcholine that makes our brain calm down, because the guys they were doing it in had epilepsy, and they showed if they stimulated the vagus nerve, their epilepsy got better. They were actually bringing their neurochemistry to a more normal place by turning up the amount of acetylcholine. They didn't realize that, but that's what they're doing. Now, at the same time, what they realized was when they stimulated the vagus nerve, that wire actually sends a message up into the brain, but it also sends it down the vagus, and the vagus goes and innervates the GI tract and the spleen. So what they saw was they stimulate the vagus, it sends a message to the spleen shoots out all these T cells, white blood cells that are a specific kind, T cells. Those T cells run throughout your body, and they secrete choline acetyltransferase. They secrete the enzyme that makes acetylcholine. That means there's now a whole body of literature that's 10 to 15 years old that says acetylcholine is not just a neurotransmitter. That's the way we learned about it. No, it's acting like a hormone. It's actually spread throughout the blood into the tissues so that every tissue in your body has a specific acetylcholine level that it wants this minute. So I would see these really bizarre things where somebody would take something and like they would go and take another B50, like their belly was upset again, the D was off, they didn't realize it, and they said, oh, I felt so good when I was on that B50. And they see it in the little closet, and they go back and they grab it, and they take it for 2 days, and they get these creepy rashes, and they start to itch all over, and they have these weird things. I'm like, how is that even happening? That doesn't have to do with the brain. So it turns out that we have an acetylcholine level below the neck that establishes this really important inflammatory system that was presenting in my practice with things like COVID toe that I was like, this is the weirdest thing I've ever seen. So there are 3 main parts to this acetylcholine message. The first is read about acetylcholine, read as much as you can about it. The weird part is we have no drugs that mimic it except nicotine, okay? Number 1, acetylcholine is a very important neurotransmitter, and it turns out this is weird, but we can develop a deficiency state when we don't have enough. When we're deficient, we get anxiety, we get ADHD, and we don't feel right. We can't rest. We can't be in the resting calm state. Everything that we've pulled in, whether it's breathing exercise, meditation, exercise, it all turns up the pantothenic acid related acetylcholine. It turns up the parasympathetic side. It ups this acetylcholine. When we're doing meditation, what we're trying to do is get our body to move towards the rest and digest side. So we're actually, when the dentists teach you about heart rate variability, when we do meditation, the heart rate variability moves towards normal. When we do breathing, it moves towards normal. So we can watch our heart rate variability as a measure of what our acetylcholine levels are being released. Now, my perception of that is acetylcholine is released from the brain stem, which is controlling the sleep. It's also really being released by the vagus. And many of the things that the dentists are doing physically in the mouth, like when you put a mouthpiece in, or when oral myofunctional therapists do things with exercises where we stimulate the palate, the glossopharyngeal nerve goes directly into the brainstem, into the vagus, and when you stimulate it, it turns up the parasympathetic side, it turns up the acetylcholine. So think of it in two ways. One is we intervene with all these physical maneuvers to up the tone, the amount of acetylcholine that's washing through your tissues. On the other side, though, if you don't have enough of the raw materials to make it, you keep turning it up and up and up. Pretty soon, you're just going to run out of it, and you're going to be a mess. So then you have to meditate all the time, or then you have to suck your thumb all the time, or then you put your mouth. So you get to a point where you've run out of your acetylcholine stores. So it's not that these interventions that the dentist or that the meditation or the other people that have taught us, how do we calm ourselves? We're using the same wiring diagram, the same chemical, but that we can actually become vitamin deficient. That means that we don't have any replacements. Once we turn up the tone, we run out, okay? So that's one way to think of it. The first supply is about the brain. The second supply is about the brain and the autonomic nervous system, okay? So if we learn the autonomic nervous system, the fight-flight side uses epinephrine and norepinephrine, but the parasympathetic side uses acetylcholine. So if I were to tell you, I think the globe has moved to humans who don't have the right supply to make acetylcholine. What does the parasympathetic side do? Well, it slows the heart rate, it lowers the blood pressure, it allows you to pee, it induces the normal motility of the GI tract so that people who don't have a normal parasympathetic side get gastric atonia, where their stomach doesn't empty. They get constipated, or they just get to the point where their belly doesn't know what the hell to do, and it just contracts all the time. The IBS picture is really a cumulative effect of not only the wrong bugs, but the nervous system of the gut is not right either. So that once you finish out the 3 months of B50, and then you move to the next phase, which is you just take a multivitamin with tiny little doses, there is a vote from your belly every time you change the B5 dose. So I have lots of people who either reach for that B50 again, and what they got when I was just talking about it was, oh, I get hives or skin stuff. But the second thing they get is a belly that starts to bloat and be painful again, because they just added a huge wash of acetylcholine that makes their belly go crazy. The weird part about this is exactly what I said before. Too much acetylcholine and too little feels just the same from the belly's point of view. It has a very strict little place it wants to be for happy gut function. And it's that concept that we use to try to figure out, okay, I just got my bugs back. Do I then need to stop all other vitamins, or do I need slightly more? Okay, do I need enough that I fill up my stores again? Okay, this is really day one of me having this extra organ of the body that we've ignored and now we know about. Do I then, over the next year or two, now that that organ is working, need slightly more of the raw materials that that organ is going to use to repair my immune system, to give back all the zinc, copper, iron, iodine, all these small charged ions that over the last 30 years, the functional specialists have told us we just can't absorb them. It turns out that the normal microbiome has been the organ of the body that's been absorbing all these little charged ions. Iron is a charged ion, has a positive charge. Iodine, negative charge. Copper has a positive charge. zinc, selenium. All animals have little things in their body, like a hemoglobin molecule. It has an iron right in the middle of it. We need little tiny doses of this, but we need enough to run all of the parts. It's been my observation that what we do the day after we stop the B50, we have the normal microbiome now, but that means it's day one of the repair 2 years where we're using little tiny bits of this in my multivitamin to actually add all of these other things that I've been deficient in that I didn't even know I was deficient in. So there's a second concept afterwards, which is once I get my microbiome back, I'm still heading into 2 years of getting my repairs done so I get really back to thriving again as a human. So in the parasympathetic side, what you'll see when you have a B5 that's right is not only is this person sleeping better, but paradoxically, their blood pressure is coming down, their heart rate's coming down. That means people who have atrial fibrillation actually have a problem with their microbiome and their D, and their sleep is contributing to this, but they have an actual deficiency state. That means hypertension is not a disease. It is an autonomic nervous system mismatch. The sympathetic side is too high. Like, that's so obvious, but because it's been around since the 1940s, and doctors had this little sphygmomanometer, we pump it up and then we look like we know what we're doing. We're measuring the blood pressure. It's just a measure like heart rate variability. It's telling you where your two interacting rest and digest versus fight flight systems are. They're way too high on the sympathetic side. Now, does that mean I should give you these blood pressure medicines? Well, that's what we've done for 50 years. Hasn't changed the outcome. People are still having strokes and heart attacks. That means really we should be attentive to, this means that the parasympathetic nervous system is not working right. What if I tell you that the wiring diagram is still intact? How would I know that? Because as soon as you put one of those mouthpieces in and you watch the heart rate variability, boom, it goes over to normal. The wires are still intact. The chemicals that do the work are out of line. So we learn how to use that to say, well, does that imply everybody who's taking antihypertensives has the wrong microbiome and their D is off and they're not sleeping? And yeah, that's what it means. Now, am I going to just give them these vitamins and magically it's all going to go back to normal? No, because there are a bunch of other things that have happened. They've had sleep apnea. Now they have to be on a CPAP device. They better stay on that CPAP device or on that oral appliance because they're getting so paralyzed while they're sleeping that these vitamins aren't going to do jack. Because that paralysis that's still there, it's going to wake them up a bunch of times. So what this translates to is you need to leave in place as many things as your body wants. And the important part is we listen to this individual's body. We listen to what their body says. Gee, 2 years later, I forgot to take my CPAP when I went to the deer lease with my buddies, and they didn't throw me off the balcony like they threatened they would because I didn't snore at all. What's important about that? I've been doing RightSleep now for 3 years and now I don't snore. And you know what? I slept for 4 nights in a row at the deer lease with no CPAP and I felt great. That means it's potential that we can reverse these diseases. It's potential that we could take out the oral appliance, but it's a long process to get there. And we're constantly watching what the body says to us. How am I doing right now? Do I need these crutches anymore? Same thing for the vitamins. We watch and see how long they need it. We always imbue the vitamins with the power to take away the sleep as well as to give the sleep. So all of the pieces that you can relate back to the parasympathetic side that are not just about having the wrong microbiome, they're really about the nervous system of the gut, things like gallbladder disease. So now, I had an 11-year-old had her gallbladder taken out. They didn't even find any gallstones. Why? Because she had belly pain, and they showed that the gallbladder wasn't emptying. Well, the gallbladder is part of the GI tract, and it just sits there like a lump. Like her stomach doesn't empty, her gallbladder doesn't empty. She has IBS, which we just say, it's a syndrome. No, it's got a nervous system that tells it to empty. Food comes along, it sends a message to the gallbladder empties. So there's a whole array of diseases that we do studies of, and we say, this person has reflux. Their stomach isn't emptying. The acid's going back up. All of those are linked to whether I have a normal autonomic nervous system that says sympathetic at this time, parasympathetic at this time, and they're both talking to each other all the time. So most of the diseases that are related to this dysfunction of the autonomic nervous system are things that we just thought are normal. Anxiety, just normal. It's it. Everybody's anxious now. No, I can dial up and dial down the B5, bring them back to the normal state, and then have them feel what it's like not to be anxious for a while. And then, we slowly don't need as much B5 and we have to taper it. And that anxiety comes back. I have to read that as, maybe I don't need this extra supplement anymore. And then, so the first part is the brain actions of acetylcholine. Then we get into the brain attached through to the whole function of the autonomic nervous system. And then we get into the third system, which is the immunity system. That's autoimmunity and immunity. So I want to get into that just a little bit more.
Can I ask a few questions before we get so long and I'm like making sure I comprehend all of this? Right. So when you said oral appliance for people, is that more something like the ALF or like a night guard?
It could actually be either, which is really interesting. It could also be just sucking your thumb.
And that's what I was going to ask. So like are thumb suckers, are people who need a because I always heard it was about the dopamine release, but you're thinking, is that a combo now or more on the acetylcholine side?
I think that the dopamine release is what we knew about, and we completely missed the acetylcholine release. And I think what I learned sitting in the audience when the ALF people are lecturing is that when you stimulate the glossopharyngeal, you have a direct link to the vagus. So it's a way of turning up the acetylcholine. When you bring the jaw forward, you're stimulating the third branch of the trigeminal, and that goes right back to the sympathetic nucleus. Both of them, no stops. They are directly doing it. Now, what that implies to me as I'm sitting there is, that means when we're asleep, we kind of decorticate, we cut off the brainstem from the upper part. But that means that I, as a person, cannot be watching whether or not I'm stopping breathing or not. Mm-hmm. You've taken away my intellect, okay? But somebody has to be watching. Somebody has to be telling that I'm face down on the pillow and I just stopped breathing, okay? We focus on sleep apnea, but every person who is unconscious, sleeping on a bed, runs the risk of occluding their airway completely. How is it that we roll over and don't die night after night after night and don't even wake up? We don't even wake up. The control of this is happening in the brain stem. The control is always like a thermostat. There always has to be a temperature side, a thermometer. It says, what temperature is it? And then it says, I want it to stay at 71. So every time it drops below, I turn the heater on. If it goes above, I turn it down. That means the wiring that you guys have taught me in the head and neck is the sensory system. So that means potentially you could actually move your jaw while you're asleep as a way to up the sympathetic. So there's not only the sensory aspect of putting sensation back, like, how do I know that my nose is occluded because it's in the pillow? How do I know that my mouth is closed and my nose is closed? She's stopping breathing. Wake her up. That pressure that happens when I'm still trying to take a breath is stimulating the glossopharyngeal, and it's changing things. So it's not only a sensory input that the brainstem is using to be constantly vigilant that the air is passing the right way. Like, how would it know if I stop breathing? Clearly, we know the brain knows that I stop breathing because it wakes us to light sleep as soon as the apnea comes. Wakes us to light sleep, we're not paralyzed, and we go back into deep sleep again. But it has to have a way to do that. It also has a way to intervene. So it could easily be that my tongue goes up and stimulates the glossopharyngeal when my brain tells me that I need more parasympathetic tone, and my jaw moves forward when I need more sympathetic tone. All of a sudden, there are all these mechanisms that you guys are reporting that you're using to get a better outcome in sleep. And there are all these features to it. It's not just the airway. It's neural input that you're manipulating. So you're getting a final oral airway outcome. But if you can put the ALF device in and see a change in heart rate variability within days or hours, that means that it's a multi-layered effect. It's not just the anatomy you drive it.
Well, that takes me down a whole other path that I think I'm going to investigate, because I think there's a lot more responsibility that we have to take when we are creating these devices for our patients. And it's not just about putting this like piece of plastic between somebody's teeth and just for the sake of not fracturing it. Like what you're saying to me with the nerves and the direct response from all these cranial nerves. I mean, that's a huge responsibility. And I don't think a lot of people even ask those questions or be aware of that. And so we kind of flippantly make these guards as if it's a dang religion now in dentistry. And we're in this cult of occlusal night guards, and like, are we truly helping the situation, or are we actually creating all these other, like this trickle down effect of sleep issues and whatever else that looks like?
It really comes back around to what you guys have already seen. Why does this do a good thing for these 5 people and a bad thing for this 6th one? That's so confusing to me. So it allows us to open our minds a little bit to say, we have to listen to what our patient says back to us. And then with this extra information, we might then be able to understand what they just told us.
Yeah, no. And again, I don't want to go down that because I feel like that's a whole other rabbit hole. But I
don't know much about it. Just opens its possibilities to me that we're like, oh my God, that's amazing.
Well, it definitely makes me want to go ask some more questions and like really kind of dive into that, because I and also for selfish reasons, because I have been a night guard wearer since the day I got out of ortho, because I was going to grind my teeth away or clench them into the future implants. So definitely selfishly want to learn, get to know some of that info. But so if I heard you correctly, B5 creates the acetylcholine. I'm not saying that right.
Coenzyme A. So there's coenzyme A and then acetylcholine. But yes, through that it does.
And then that is ultimately now we're seeing is a hormone?
Yeah. So, it's an inflammatory hormone. It's an anti-inflammatory hormone that adjusts minute to minute during our day.
And then we also understand that D3 is a hormone.
Yes.
So I guess I'm trying to like let my brain go is like, is it kind of irresponsible that we can buy these things over the counter?
Yes.
Okay.
But
sure.
here's the good part. This is the weirdest part of medicine that I've ever been in. The good thing is that the doctors are not just uninterested. They are actively against. And we can talk about that in detail at the present time, because what that's done is, and there are reasons why they are actively against. It's not really their fault, but it is the fault of the way science has drifted. And that is a really important piece, because what's going to happen now is I give you all these ideas, you go in and try to discuss it with your doctor, and you get nothing but blowback.
Yeah.
So it's really important once you have these important ideas, especially about your children, that one, you have a resource to handle these things safely yourself. You have to know the good and bad aspects to it and how to do it. That's why I have a workbook. That's why I have a website. But you also have to understand why medicine today doesn't see it this way, how that happened, what happened over the last 40 years to make that happen. The good point is we actually have vitamin D across the counter. That means we can do this on our own. There are countries where they don't allow that. I have clients in New Zealand who tried to order vitamin D on the internet, and it was taken at customs. If they try to, and these are all, I don't know what the situation is in Great Britain, but I know that in Canada and in New Zealand, you cannot buy vitamin D in a higher dose than 1,000 IUs. So if I'm going to use 15,000 a day, I take 15 of those stupid little pills. And if you take it away at customs, that's kind of a weird concept, okay? You have said as a paternalistic medical society that I actually know better than you stupid, uninformed layperson. That is an ancient way of thinking about medicine. Ancient, like 30 years ago. I'm sorry. Every single human being has access to every single scientific article that I, as a physician, have access to. That means I, as an informed layperson, I am being prevented from doing my own investigation and pursuit of my medical care in the path that I want, because my medical community has decided that they're the only smart people on the planet. Well, you know what? Right at the moment, medicine is not that smart. because this epidemic has snuck up on them, and they are telling their patients, millions of which have terrible pain, who can't sleep, who are depressed, who are anxious, who are dying of COVID. They have told them that they don't really know what's wrong. That means medicine really is not answering the questions of the lay public. That's why you're making this podcast, because in actual fact, the weird part is that many of the dentists understand this in a depth, and they can't convey it to the MDs around them. So that's how I got into this particular forum, is the dentists turn out to be much more open-minded. They have now attached the anatomy of the head and neck in a way that the MDs won't even listen. They won't sit still to listen to it. And unfortunately, the basic science that the MD is reading says, yeah, it's true, there's a 35,000 articles that suggest that vitamin D is linked to all of these diseases you see every day, but the clinical trials have not shown a cure. And we can talk about why that is, but what the clinician's role is really to take animal science, cellular science, all the other population of animals on the planet, their biology does this, and this is what vitamin D does in them, and it suggests these results in these 35,000 articles that we could actually, if we knew what we were doing, cure diabetes, get the sleep better, make sure that we don't have infertility, make sure babies are not born prematurely. We could take all that animal stuff and we could move it to humans. But what the clinician's role is rightly to protect my patient from science that's being used wrongly, okay? That means the clinician is really focusing more on the article that's about, did they do a controlled trial that prevented cancer and heart disease? Like, we can review that one, and I can tell you about, this was an article I was given by one of the dentists for their study group, and he said, here, review this article. And so that piece about what's happening to your doctors, because every single caregiver has to be completely committed to getting people better, or they wouldn't stay in medicine. Medicine is a terrible field right now. It is very, very difficult to practice. And the only people who stay in it are the ones that really do care about taking care of their patients. It's very difficult. They really do want to see a better outcome. They just don't understand this yet. That means your original question was, isn't it dangerous to have this in the hands of lay people? Yeah. That's why I have a website. That's why I have a workbook, because it is dangerous. And I want you to understand that when the front page says low vitamin D and everybody's just taking 2,000 or 5,000 or 10,000 or whatever, it is dangerous. Now, do I think it's better to be in Canada or New Zealand where my doctor wants to slap me because I took 2,000, where I'm being treated as though I'm stupid and I don't have the right or the intelligence to learn this on my own? If you guys want to stay in the past and not fix me, that's your business. But as an individual, I should be able to pursue that. So there's two different mindsets that are currently battling. And it is dangerous to have these vitamins on the shelf. But you know what? I'm really glad we have them, because that's why I'm here teaching you how to use it.
Exactly. It's a great point. And I wanted to also ask about if taking too much B5 really makes you anxious and anxiety when it drops. I think you said they kind of do very similar things, but is there also depression at all with any of that?
Yes. These
is
are
that when it
dangerous
drops?
Chemicals. So let me give you one more piece. You have other questions before we circle back to that?
How does tongue posture relate to stimulating that vagus nerve?
Excellent question. I don't know the answer, but I'll bet you that the oral myofunctional therapists have seen all sorts of things happen, and they have a set of clinical observations. The reason why that field is exploding the way it is they see these positive outcomes. They are watching things happen. They're not just making bullshit up. I mean, why would they? Okay. They see these amazing things happen. My kid can sleep now. My kid can pay attention now. My kid is not just running around the house, banging against things and hitting people. They see these amazing changes, and they're doing these things. So now that I've been doing this weird stuff for like 10 years, what I realize is it's a lot of work to put together a coordinated clinical plan and to make someone believe you. That means all the caregivers that are doing that have seen miraculous things happen. We may not understand the chemistry or the physiology of it yet, but it's part of an interlocking physiology. So when we finally do put it together, we go, that's why this does that. That's amazing.
Yeah. And my last question from what you just taught me, or at least it made me think, you said that, we're a society that doesn't have, a lot of people are lacking in the B5 and the acetylcholine. And it made my head go to epigenetics and like how many people are, I don't want to say suffering, but have had their genes expressed and now they have different facial structures and tethered tissues and all this stuff. Are we to a point in society where we have created a genetic change that we can't fully come back? Is this something, because it's a hormone, can we take enough and I don't know, all kind of get healthy and hopefully healthier society?
I prefer the more optimistic look because of what I've seen. Okay. You just encapsulated the current mindset. And what I want to give you is, we know so much more about genetics, and we know about epigenetics, and we know about metabolomics. We have so many things that we can measure, and yet we skipped this central core of our biology. It has gotten left behind. So we've observed all these things that happen, not realizing that there was an actual mechanism for them to occur. So let me try to put that together. So one of the most important pieces is that you and I are both crazy about what sleep can do for you. That sleep is a state in which our body, when it's given everything it needs, is able to repair everything. It knows how to repair everything. It knows how to make normal humans. That's a miracle. How does it make these kids go through these developmental stages? The fascinating part is we can look back and say, wait a minute, the Roman legion took over the whole planet. They didn't have the perfect diet, and they were basically about killing everybody. But you know what? They ended up with these amazingly organized societies with roads and this amazing level of civilization. And you know what? That was before our doctors arrived. Oh my goodness, how could they possibly have done that without any doctors? Wow. This means that humans really were able to cover the planet and dominate the whole planet like roaches, okay? We have taken over everything. And that's before we knew about the paleo diet or the keto diet or microbiome or bacterial growth factors. We didn't know jack. We just pop out and then we grow up and then we try to kill people and then we live to 75 if we're lucky. The things that were killing humans at that time were epidemics and starving to death and war. Those are the three things, okay? Now we move ahead and we move into the last 200 years where we really have had little wars that were terrible and killed a bunch of people. But for the last, at least since World War II, the wars are smaller. We've really taken out almost all the epidemics. The only reason why people are freaking out and making this a political thing right now is we're just not used to epidemics anymore. We've lost track of the fact that these used to kill us all the time. This was human life, as it was with every animal. So we are, in the last 200 years, we actually have societies where nobody starves to death. So we've taken out the three major killers, and now we're left with a different thing. We're left with humans that are weak, that are not immune to things, that are not able to fight off infection. We're starting to see that the projections for the lifespan of my grandkids are actually shorter than my life, okay? And we really do have to then say, okay, there's nothing wrong with the keto diet or the paleo diet. Those are good answers, and I'm glad somebody's paying attention to Roundup and GMO, okay? That's not my job, but I'm glad they're doing that. Now, when I'm just sitting with someone and I'm saying, gee, and the way I got at this, what you asked about, which was epigenetics, and am I able to send them back to where they were? So here's my view of it as a neurologist. I'm sitting there, this gal just put on a CPAP device and her headaches went away. And I'm like, no way. Those things are crazy. That only a human would come up with some of that stupid, okay? That's totally unnatural. Yet her headaches went away. And that makes me into someone who's so fascinated with sleep. Now, once I get fascinated with that, it also means, does that imply that if I sleep normally my whole life, and I happen to live in a society where I'm fed and I don't get terrible infections, that I would actually live to 75 years old before I had my first medical problem? Because my brain actually knows how to repair every single thing. Does that imply that? To me, it did. Mostly because I've lived a healthy life up until my 50s when I started having a sleep disorder, okay? Now, that's a really different way to look at medicine than what I was trained, which was we're created or we pop out, or you can look at it religious terms or evolutionary terms, doesn't matter. We start our life and then we're destined to fall apart. And everybody has their own falling apart mechanism that they inherited, okay? So when I start doing sleep as a treatment, my headache patients get better. And they're not on CPAP if they don't have sleep apnea. I use sleeping pills and then I use these vitamins. But the central core is if I can get your sleep better, your headaches go away. Headaches are a genetic disease. They're always a genetic disease. Epilepsy, genetic disease. I got CT scans. They don't have brain tumors. They have a genetic disease. I saw the epilepsy go away. I see the tremor go away. I see the gait disorder go away. I see the memory disorder that's not Alzheimer's, but a memory disorder because of a sleep disorder go away. I see psychosis go away. So your question is, are we down a path where our anatomy and our expressed mutations are already kept us tied to that path, or can we actually fix it? It is my belief that we can fix almost all of it. I'm not certain about cancer because I think it's in a different place, but we can circle back. But anything that is a matter of I was born with a genetic mutation that makes me tend towards X. Anything else that my family has, I didn't have that in the first 10 years of my life. That means I only arrived there after my sleep was lousy. And in fact, the miracle is the brain is designed to know exactly what it's supposed to do. It knows how to repair everything, okay? Let's say we arrive at, humans find stem cells. They weren't put there for us to find them. I'm sorry. I know that I want to feel like a really cool dude because I found these stem cells, but that implies that we actually have the potential, if you flip into repair mode, and that is a very specific place. If you flip into repair mode, you can now call out a cell that can replace my damaged heart muscle. It can replace my liver cell. It can replace my kidney cell. It can make new brain cells. It can do all these things that we've actually been doing every day, but we didn't notice because we just wake up every day thinking, okay, what I'm going to have for breakfast. We don't notice that our kidney was repaired, that our lung was repaired, our heart was repaired. We don't know. We look in the mirror and we go, oh, more wrinkles. Actually what's happening is we've been regenerated to look exactly the same. That's like a miraculous thing. So it is my belief that accepting cancer, which is a slightly different issue, that everything that has a genetic basis has the potential to reverse itself given perfect repair. There are also some really fascinating things that happen in this RightSleep program that I'll add now that it's perfectly timed if you don't have another question.
Nope, that was the last one.
Okay, so here's the next piece, which fits perfectly in this. So I told you that there are these stages. First I do D, and D helps a bit, and then it's really a pivotal part of our hormonal system, and then everybody falls apart. And then I stumble into this B5 thing. I get the microbiome to come back. I realize that the microbiome is making all these vitamins that are making all our neurotransmitters. They're directly linked. Then I stop my B50, all my pain goes away, and at the time, I was not taking a multivitamin. Okay, this is at the very beginning, and I don't know, and I don't really believe in vitamins. I'm like, I've never taken a vitamin in my life, so why would I do it now? So for 6 months, I got my D in line, my microbiome is back, I'm feeling fantastic, I'm running up the hills now, my performance is better, and then I get this peculiar butt pain again that I had when my Bs were off, and I'm like, this is weird because this does not relate to any injury. I can't sit down at the end of the day, my butt bones hurt, I don't get this, but this is very similar to what I had before. And now my sleep isn't that good. My D is perfect. What could be wrong with me? Why would a human being ever need any more Bs than what is made by the microbiome? It is my belief that our biology was fit perfectly to their supply. But I've now been sleeping extremely well for 6 months. So I think, okay, well, maybe I'm sleeping so well that I'm making I have a nightly repair list, okay? Because this is the way I think the brain is organized. It has a list that it does every single night. And what it's saying now, it's 6 months after I stopped the B50 was, I've done my nightly repairs every single night for 6 months now. And I think we're doing well enough that I could do some roof repair. I could do some foundation repair. I could clean out the gutters. I could do these things that are actually left over from 30 years ago when you didn't really have full repair. This is the piece that suggests that I could reverse my autoimmune disease that I've had for 30 years, okay? This is where we really want to be. It's not just, I feel a little better, I'm sleeping a little bit better, but does the brain have the potential to say, there are really 2 million repairs that I haven't done. I've put off the last 1.5 million because I didn't have time every night. But if you would just give me a few more of the building blocks of repair, I know every single thing that I did not repair. And I am assigned to fix all that, okay? That was my fantasy. That's a story I made up. I go and I reach for a multivitamin that has 5 milligrams of pantothenic acid because I'm really freaked out about that stuff now because it made me hurt. So I take this little multivitamin, I take it for 3 months, my butt still hurts, and one day in desperation, I take 2 of them, and I have 10 milligrams, and my pain goes away the following day. And I'm like, no way. I mean, I took 500 milligrams of this stuff. I mean, I had restless legs around it, but my head didn't blow off. I mean, there was no big deal. Now I have like day-night change in 5 milligrams. That is bizarre. Now, that was step 1. I ended up on 10 milligrams and my pain went away. And 6 months later, I start to have restless legs in the morning. So I go down to 5 milligrams. And then another month later, I get restless legs in the morning and I go down off of the multivitamin. And from then on, I'm off the multivitamin. Right or wrong, I had a construct in my head, which was, I don't understand why, but it appears to me that there's a phase that is linked to the D, okay? In the background, you asked about epigenetics and expressing. D is a trophic factor. D has a million effects in our body that we don't understand, but it has many scientific articles that talk about D changing the methylation or histones on the DNA. So when you keep the D ideal, something else happens that takes about 6 to 8 months to happen. It's not about sleep. It's about genetics. It's about DNA and expressing things. So now I'm like 6 or 8 years later, and now I've watched 8,000 people go through this stepwise year-long event. And what happens routinely is when you stop the B50, that is now day 1. The next day is day 1 of being a normal human with this new organ. What I learned over time was 3 months after you stop the B50, if you've kept your D exactly right, 3 to 3.5 months later, so it's at the 6-month mark of the program, you will start to need more Bs. And it will manifest in the same way your B deficiency manifested, which is extremely confusing. The people who got burning of their feet or hands when they were B5 deficient will start to have burning again. The people who had sleep interruption and couldn't fall asleep, they'll start to have the same thing again. The people who had IBS, they start to have that again. The manifestations that we had were our body's way of saying, these are the things I manifest when my Bs are off, my B5 is off. That shows up at this 6-month mark. I still don't have a good explanation why that is. I've made up this story that's linked to sleep, but it may not be linked to sleep. It may instead be linked to specific things that happen when the D is ideal. Because what we have when we go to 60 to 80 is really the thriving level. It's not the normal level that Africans who are hunter-gatherers who don't even have a hut. So there are still tribes that live completely outdoors. When you measure their D levels, they range at an average of somewhere high 40s, low 50s. But the piece that they haven't gone to in those groups are, who is the best performing athlete in this tribe? Who is the sickest one in this group? So we're looking at the bell curve But if you and I want to say, well, I'm sorry, I don't want to be on the sick end of normal. I want to know if we can, is there an ideal place? And since I can test my D levels now, I'd like to stay around there. That gives me the opportunity to actually walk back time and actually allow my body to be so perfectly aligned that I can repair things. And the reason why it's still important to me is I've seen people go from being really mucked up, stroke at age 72, lupus for 30 years, really not able to put two sentences together, confused, agitated, angry, completely divorced from their family because they're such a pain in the ass, to being normal, like no joint pain, no inflammation, no need for Advil, putting sentences together, being reincorporated in their family and caring for others because they physically feel so good. So I saw these miraculous things happen. It's not easy and it's not direct. It's really a thought process. But in the background, it appears to me that keeping the D ideal leads to things that happen at a 6-month mark, which is really more about expressing other things, expressing other proteins. Okay, now, right at the moment, I have several clients who at the 6-month mark start to have burning. Okay, now they've been on 10 milligrams of B5 for 3 solid months. And the original disease of this particular first client I'm going to tell you about was when in her mid-20s, she started to have terrible burning, aching pain, and just felt horrible. And none of the doctors could explain what was wrong with her. And they would say, you look fine. You're not supposed to be sick like this. I mean, that was it. This is not supposed to happen to you. She went finally to a naturopath who got her on D and on like B50 or B100 twice a day and actually cured her. She didn't quite put it together the way I heard it, but she got cured. She became a business coach instead of a singer and a performer because she couldn't play piano anymore. She's helping me with my business. She writes the workbook again. She decides that she wants to do this process because she recognizes that's her. She does the first 6 months, no problem. Everything's great. At the 6-month mark, the burning starts again. She hasn't had it for 10 years. Like, this is the weirdest thing as a clinician, and I have no explanation. I'm just warning her, within the next few weeks, you might. And then she starts to take B5. There is a third section in the workbook, which is if you stick with this program, you have the option of actually getting you to the best human you could be. But at the 6-month mark, you're going to have to start turning up the Bs just a little bit. She had to go into really high doses of B5, and we actually switched her over instead of using like B100 or B50. Some people probably have a genetic mutation that means that they have a specific need for B5 that's out of the range of all the other Bs. Because the Bs are all so intertwined in both their production and their use in their body, that if you need one, you need all of them. But she got up into above 100 milligrams. And every 3 days, she would go up to 105, and she would feel better for 2 days. And then on the third day, it would come back. And she'd go to 110. And then she had to go to 130. It was this stepping up. Like, what is that about? How did this person function normally, physiologically? We're so aware of it because it's something that hurts her. It's a physiologic thing that she is absolutely consciously aware of when she opens her eyes. Unlike renal failure or a liver failure or your pancreas is dying. Things inside that don't have sensory messages are doing the same thing, all right? But we can't get at it. We can do little lab tests. She's turning this up. She finally gets to 240, and everything gets worse, and we have to come back down, all right? Now she's at 220, and she's at 220 for like 3 months now, and she has no pain. But what's going to happen eventually, because I've gone through with other people, is another 6 months goes by, and the burning will come back, and she'll have to come down again, all the way off. So something just happened there. That means your original question is a very deep one. Are there parts of this that are changing the expression of our genes? Yes. And it makes my hair stand on end because I don't really understand all of it. But at the same time, it gives us an opening to actually repair things that we've just watched people go into renal failure and die. This is behind renal failure. This is behind diabetes. This is behind heart disease. It has layers and layers of complexity that I don't understand yet, but I keep wanting to put this in the hands of the people who do the basic science for, cardiovascular disease, et cetera. I'm running with this guy who's 10 years older than me. His stepchild is 42 years old, has just been admitted to the hospital for heart failure. And they just say, you're going to have a heart transplant. What? He's 42 years old, okay? We just make it up and we say it's a viral infection. And then they give him a bunch of drugs and he gets a little bit better. And it happens to be like March or April, it's in the spring, and he happens to be pretty dark skinned. So much of what we're treating with, you'll just have to have a joint replacement, you'll just have to have a heart replacement, you'll just have to have a liver replacement, is because we haven't gotten our hands around this potential to heal.
Well, I will say I have not gotten to step 3 in your workbook, and my sleep issue or my issue is burning tongue. And I think we've talked about this before. Mine is back. And I also think mine, it manifests with my clenching. And so I'm actually going to start doing my own little experiment with this new device called Brux Relief, where it sits on the temporalis and gives me data at night. And I'm going to go get my D tested again.
Did the burning tongue go away?
Say that again?
Did the burning tongue go away?
Oh, yeah. Mm-hmm.
Okay. Then you need to turn to the part 3, because when it came back, it was telling you something important. So the first thing always is check your D level. But if your D level's been okay, you need to go to that part 3 and read through that whole section and start dialing up the Bs in tiny little doses.
Well, I think I've never got to the right amount of Ds, because right before COVID was the last time that I got my D tested, and I was at about 47, but up from 17. So I felt very good. Yeah, I was super deficient, and I've still continued to take my Ds. I just need to get that.
And you need to get levels, because if you keep taking it, you're going to get in a bad place and you won't notice that it's that.
Exactly. So I think I have, for a little bit, followed yours, and then I just kind of went off course, good old Rona. I'd like to blame Rona, but I really don't have a good excuse.
It's what happens to all of us. Life intervenes,
Yes.
Setting up a treatment plan that's about doing the same thing every day, but watching what happens to you. Like, you can assign people to do stuff every day, and then they get in the habit. But then the hard part is then your physiology changes and you have to respond to that. You have to be noticing. That's really hard.
Yeah. And mine is definitely the burning tongue. It comes back, and maybe it's like 2 days. And I'm like, God, it's back. I hate when it gets like this. And I think the last time that it happened was like right when we last had our Facebook Live, which was, I think, almost 6 months ago. And you told me to get off the B50, I think, at the time. And I did, and it got better. It was so much better. And now it's back, and it's at about that 6-month mark. So I definitely just need to go get mine tested. But it's so fascinating that I also noticed that my clenching and grinding and my parasomnias kind of start coming back with my tongue burning. So interesting. I mean, so if anybody is interested, how can they find your workbook? How can they get on? How can we start guiding our patients to this information?
Okay, my website is www.drgominak.com. I've been told by all my business coaches it's a terrible name for a website, but I'm the only Gominak on the whole planet. So if you just type in gomaflogy and vitamin D, my website will bump up. So I kept it because it's worked. Now, the second piece is I have just finished making a set of videos for women who want to get pregnant and want to use D correctly and safely during their pregnancy and during the first year of life with their baby, because you have to calculate what you're doing with your blood to get the babies right, to get them to sleep right. That is a bit difficult. It uses exactly the same concepts we just talked about, but it's really special attention to that use of it. So I have a set of 3 or 4 videos that are about that. I have a set of 3 or 4 videos about how to use RightSleep in children. Those videos don't have the why behind them. I just gave you a lot on why. I'm going to make a special section on the website when I get a chance that builds out the why for pregnancy, for breastfeeding. There are some things about this. You're at a risky time in your life, and you want to make sure that since your OBGYN is telling you something different than I am, that you have some science behind it. So I don't have that scientifically filled out. I do have a lot of really good articles from a guy named Bruce Hollis and another gal named Carol Wagner, who are a pediatrician and an OBGYN, who've done most of the actual proof in the controlled trials in pregnant women and breastfeeding women. and they are really, really brilliant. So I'll have those articles on it. At the moment, what I have is the how. So these very directive videos to say, this is what kids' sleep should look like, because nobody's as normal now. This is what your sleep should look like during your pregnancy. This is what your infant's sleep should look like. And therefore, if not, these are the things that you should do. So I have 2 sets of videos that are meant to support the workbook, and I'll be building on that over time. So on my website, most of the stuff that's on there is the why. There are multiple podcasts, there are webinars, there's a bunch of written material, blogs, frequently asked questions. So it's the why behind this that you and I have actually been discussing it. The workbook is the how, the stepwise way to do all the little things we talked about, how to get your D level done in the right way. There are very specific things you need to know about getting your D level done, and let's talk about that now. In the US, we are lucky that we have a testing service and more than one, but the simple, easiest, quickest, cheapest one is through ULTA Wellness. It's attached to Quest. In all states except for New York, Rhode Island, and New Jersey, you can actually just make an account, order a vitamin D level. The first one that pops up is called Vitamin D Cardio IQ, for reasons that are not the least bit clear to me. And after that says LC/MS. LCMS is the proper expensive machine that does an accurate test. So I have all this on my website and in the workbook. You can actually put in your information, and for $39, you can get your D level done. You go to a draw station near you, you get the results back in 3 days. You do not have to argue with your doctor. You do not have to ask anybody else's opinion. You can directly do this yourself. I would really recommend that you use that. There are other ways to get it done that are blood spots, which means you prick your finger, you do a little drop on a piece of paper, you mail it into the lab, and they send you back the results. And there are several agencies that do that in the US. Make sure that it's always LCMS technique. One other piece, not only are doctors not well informed about D, science, and physiology, but the lab companies, in reaction to us asking for more and more D levels, have made cheaper methods to test the D, but they're not accurate. They distort the actual value by 10 or 15 points, which is a lot. So all the hormones that are studied by all doctors are done in this big machine called light chromatography mass spectroscopy, because hormones have very specific shapes. And you have to do the test. To be accurate, you have to do it using that. Because D is kind of like the poor stepchild of endocrinology, of hormones, and we've asked for the test multiple times, but the doctor doesn't understand the significance of the results. They are now doing, most of the labs are doing D tests with immunoassay. An immunoassay is done with an antibody that's directed against the vitamin D. It recognizes a certain shape, but it can't really give very accurate results. And there's now lots of scientific articles that show that immunoassay results are off by 10 or 15 points. If I tell you you have to keep it 60 to 80, that's too much of an error. You really won't be able to tell how your body tells you that it's so. That means the immunoassay that you get through your doctor that says it's 40, it's really maybe 32. And 40 and below, the immunoassays are closer to the reality. But once you go above 40, so once you step into my world and you try to use this, getting your blood level to have good health, you can't use those immunoassays. They're not accurate enough.
And I will tell you firsthand, if you sign up for ULTA lab tests, you will also get a newsletter that gives you all kind of discounts.
Yes, they give you these 20% discounts. That makes it really nice. That's the only thing I look forward to receiving. Like, oh, another coupon.
Exactly. So it's definitely worth checking out the lab and sign up for their newsletter, because you can get your D tested. And that honestly was the best news because I've done that on my own for 2 years now. And yeah, so easy. And the best money spent. Any other little tidbits that maybe I didn't ask you that I should, or that the audience should hear before I let you go? But I swear I learn something new every single time that you come on. So thank you so much.
What I would say in closing is, I just spent over 10 years learning about this, figuring it out, piecing things together. It's very complicated. That doesn't mean that it should keep you from doing it. It just means you should give yourself a little leeway to read about it several times. Many of the people who come to want to be clients are so screwed up and so sleep deprived that this is way too much for them to get their head around. It's too complicated. So I would encourage everyone to take it in little bits. Start with a little bit of stuff. Try to follow the workbook. When you start to sleep better and feel better, read more. You really do, if you're not working with me, and I don't have enough of me to go around the world. So if you're not working with me, you really do have to understand what we're doing in the background. You just gave a perfect example. You just drift off and, the same thing I had before comes back, but you're not writing it down and you're not attaching it to the time frame that we talked about. So you really do have to keep a record. And I'm putting together it's going to be called the RightSleep Journal. I'm going to make a whole year's journal that will hopefully encourage you to write everything down every day and give you little encouraging bits like self-help books do, and reminders, and in another week you're going to have to do this. So I'm going to give you another thing that's going to help you, guide you through a whole year, and help give you little bits of education along the way to help remind you. Because the workbook that we have now is meant to encompass all the things you have to do in a smaller piece so that you can read from front to back. You can read the whole thing in an hour, and it really takes you through what the whole program is going to be. But 6 months from now, you don't go back and read it again, okay? So it's very easy to lose track of it. So I'm hoping with that additional journal that will be able to keep people on track a little more. Also, I have a special journaling video for people who are going to try to do this with their kids. You can imagine how hard it is to do and you have 3 kids and you're trying to do it with all 3 of them. It's overwhelming. So I've actually done a whole video that's about some tips about how to journal with each kid based on their age group, how to get them engaged in journaling with you once a week so that you can write down something with each kid kind of tailor-made to what age group they're in. And you'll be surprised that the preteens and teens actually will take this on. When they start to feel a little bit better, they'll be telling you, Mom, I think I need a D level because of blah, blah, blah. So if you can get them engaged and have their own journal to write in, and it doesn't have to be mine, it could be a 3-ring binder, but I give you tips about how to get them engaged and start journaling with them. It really makes it, that's the only way you're going to succeed, is to keep records over time.
Well, and I love that because it really brings you, or it teaches kids very, very young, and then it helps you to be very aware of your body and your health. And when I spoke to Sarah Hornsby in the recap, we were talking about like tongue posture and mouth breathing and nasal breathing, and how if you lack that awareness, then everything kind of falls apart. And so this just really compounds that idea that, I mean, journaling is great for mental health. Now I'm hearing it for your physical health. I mean, that's a brilliant idea, and teaching people at such a young age to just be aware. Like, we've normalized a lot of crap. We really have. We've normalized it. We've normalized headaches. We've normalized crappy diets. We've normalized grinding and clenching and oral disease and all that stuff. And I think this is a nice way to like reverse it a little bit.
I think we can all walk out of that hole. And really what I want is not only walk out of whatever's happened, slowly over time we get everything better, but what I really want for everyone is to be competent to do this program, the idea set, that when my sleep goes bad, no matter why, that I'm gonna really fail. So I have to pay attention to why is my sleep going bad and do something. The idea that if you keep your sleep good over time, and it's not just sleep hygiene, there are many other things you can do to intervene, you will have a better outcome for the rest of your life.
Well, that is a great note to end on. So thank you so much for coming on. This was another long form, fabulous podcast. I eat it up. So thank you so much for your time and your expertise, and to continue this mission to help educate us in this dental profession. And I'm very excited to hear that dentists and hygienists are kind of the front line of making some changes. That's exciting to hear.
Thanks, Michelle. I'm thrilled to be back.
Well, I wanted to say thank you again to Dr. Gominak for spending some time with us. I learned something new every single time that I chat with her. Definitely go check out her website. I'm a testament to the workbook. It's doing a great job for me. Get your vitamin D test and stop normalizing grinding in our profession.
Amen.
So if you have any questions, you want to reach out to us, you can find us at ataleoftwohygienists.com, where you can also sign up to our newsletter. And we are sending all kinds of stuff out, like, you know, you can get CE for this. And if we have expiring courses with CE attached to them, then we'll let you know. Go take it before it expires. And we want to say thank you so much to PDT for sponsoring yet another year of CE for this podcast. Paradise Dental Technologies, they support education and make fabulous instruments, and also are fabulous human beings. So thanks, PDT.
Seriously, they really are.
And if you want to, we would love for you to follow us on all of our social, LinkedIn, Instagram, Facebook, all that jazz, all that stuff. And if you want to send us an email, you can do so at Michelle or Andrew at ataleoftwohygienists with an S at the end.com. And we would love if you shared the episode, and then also rate and review us at one of your podcasting apps. Apple, if you're on Apple, that would be fantastic.
Quit plugging Apple, all right? It's Google all the way.
Yeah, but don't we? Well, I don't even listen on Apple. So I've sold myself to Apple, and I don't even listen on Apple. If anybody's an app developer out there, I would love for you to develop a podcasting app where you can take notes.
That is ingenious, actually.
I mean, I cannot even tell you how many times I'm like listening to a podcast and I'm like, I wish I could bookmark, like almost like a Kindle or not a Kindle, but like an Audible or something like that. Where I'm listening, I can like, here it is. Here's my note. Here are my thoughts. Go back and look this up. God, wouldn't that be fantastic?
It'd be so interactive, like with the actual recording. Well, I'm glad that you saved this to the very end where no one listens anymore. Because they're like,
I know. Sorry.
But you know what? Daniel will take it and he'll run with it and he'll be rich for it. So good luck, Daniel.
Yeah. Well, I think that's all. I hope everybody had a or is going to have a wonderful holiday. Don't say Happy New Year. Say Jumanji at 12 o'clock on December 31st. We need to get out of this game. Just go ahead and prepare yourself.
Oh, I'm glad I didn't know you were going to say that.
We have reached the final level. Please say Jumanji. Do not say
this
Happy.
game.
2020. We have to.
Oh, that's good. That was a good one.
Anywho, I hope everybody has a great week.
All right. Bye, everybody.
Bye, y'all.